Our first guest is truly a music legend. He's best known for the hit songs Copacabana, Mandy, Could It Be Magic, and Can't Smile Without You. Please welcome singer-songwriter, musician, arranger, producer, conductor, and show-stopping performer, the one and only Barry Manilow.
First time I've ever done anything like this.
Really?
Absolutely.
So you get to hang out with the docs?
Yeah.
We'll call you Dr. Manilow for the day?
Well, you know, people like me, I think we do kind of heal people out there in my little world of music and making people feel good. I hope that they walk out feeling better than they walked in feeling. That's my goal.
Well, that's your goal. You know, Barry, you touch upon a really important point, which is it's not even your little world. Music does have a positive physiological response in our bodies. When we listen to music that we like, and certainly I think everyone in this audience can say they've listened to your music, and it makes them feel good.
Okay. I'm glad I could help, but what I'm here about is to talk about this atrial fibrillation problem. Well, I've had atrial fibrillation for 15 years, and I didn't know what that was. I do now. Boy, do I now know what atrial fibrillation is. It's kind of a real innocent kind of thing. You feel like your heart's skipping a beat, you know, like plump, plump, plump.
Like aware of your heartbeat.
Plump, plump, like that. You know, I was driving and I said, well, you know, maybe it's stress, or maybe because I'm playing a concert tomorrow or something. I kind of ignored it, but it kept getting more and more out of rhythm. It wasn't like you're jogging where your heart just goes faster and faster. It wasn't that at all.
Let me show everyone what was going on with your heart, because 2.5 million people suffer with atrial fibrillation. So normally, when your heart's beating, when you're not having any problems, it has a very normal rhythm. The beat is transmitted from the atria, which is at the top of the heart, through the ventricles, very regular. We call that a regular rhythm. With atrial fibrillation, up in the atrium, the top part of the heart, essentially it's quivering. And that conduction is irregular. We call it an irregular rhythm. As you see, that fluttering that's taking place, that fibrillation, you can feel that in your chest.
Oh boy, it feels like there's a fish flopping around in you. It's like a flounder flopping around in your chest. It's scary. I mean, who thinks about your heart? I mean, it's the first time I actually said, well, there must be something in here somewhere, you know, like my heart. Because, you know, you don't pay attention to your liver, your kidneys, or your... And there it was going like that.
You know, and somebody like you who's lean and good shape and active and dancing around and all that, you wouldn't think that you would be set up for a heart problem. But this is a different type of heart problem.
But you know, what I'm learning, you know, not only do 2.5 million people have this thing, but if you don't take care of it, you're playing with fire. And this is dangerous. And so that's why I'm here.
It is really dangerous. So if you have symptoms of atrial fibrillation, whether it's a pounding, fluttering in your chest, these palpitations we're talking about, shortness of breath, you feel weak, you have a little chest pain or fatigue, and dizziness can come with it because your heart's not beating blood as efficiently as it normally does. And what we really worry about in the emergency department is if you have that irregular atrial fibrillation and it's conducting really fast to the ventricles, which is the part of the heart that pushes blood to the rest of the body, that can really cause a lot of problems and even lead to heart failure. The other big thing you mentioned, the complications. Your risk of getting a stroke if you don't treat atrial fibrillation is astronomically higher than if you treat it appropriately.
That's right. And but what's dangerous about it is that it doesn't feel like it's really take it seriously. It just feels like your heart's skipping a beat, so you don't really pay much attention to it until it gets wacky, until it gets crazy. That's when you really need to call your doctor.
So have you had any like real scary moments with this?
I do remember one. I was doing the July 4th thing in Boston with the Boston Pops, and it was a big moment, you know, and I got up in the morning and I felt this thing starting. And I called my doctor. I said, I think I'm in AFib. You know? So he said, get to the emergency room. Because what they do, if they can't stop it with medicine, they have to give you the paddles, you know. Right. They clear, you know. And when you wake up, your heart's back in rhythm. And I kind of staggered to sound check, and I did the show that night. But that's the only time that I can remember that it actually interfered in the shows. But it could.
You've had ablations done?
I have, 3 of them.
And that's where you have this irregular area in your atrium that sends off all these irregular signals, and you'll actually, the doctor will go in and try to ablate that area so you don't have that foci sending the wrong rhythms. And has it helped you?
It has. Yeah, the first two were better, and then the third one, it's really, really helped me. The third one, I don't have very many episodes.
And the best way to describe what Barry feels when he has AFib, just like anyone at home, is if you do drink way too much coffee or you take a stimulant like is found in a lot of cough and cold medicine, anyone's ever had that feeling where you just feel uncomfortable and everything's racing too fast? That's actually something you want to avoid if you have atrial fibrillation. Too much caffeine, stimulants, because one of the first things we actually check for if you have atrial fibrillation and you have a fast heart rate is we'll actually check things like your thyroid hormone. Because if that's too high, it can inspire an attack of atrial fibrillation. So don't ignore the symptoms because there are treatments not only available, and if you end up living with atrial fibrillation, because some people obviously live with it, if they're older, ablation therapy hasn't worked, a lot of people will go on blood thinners to prevent strokes.
Well, you're doing all the right things.
I'm on it. And I don't want to scare anybody about me because I'm doing great. I'm taking care of, right and left. It's you that I worry about. That's what I'm here about, to make sure that everybody does this.
You're sending a great message.